Why is one of the most powerful health companies in the world under silent siege? And how could their empire be facing a slow-motion collapse from within? UnitedHealth Group, America's largest health insurer, has been admired for years as a financial juggernaut and healthcare integrator. But behind its fortress-like image, there's a storm brewing, layered with lawsuits, federal scrutiny, privacy concerns, antitrust alarms, and strategic miscalculations that no amount of EBITDA can hide. Let's start with the basics. In 2024, UnitedHealth reported a staggering $379.8 billion in annual revenue, with a strong EBITDA of $34.4 billion, and they're still aiming to hit a $40 billion EBITDA run rate in coming years. Their vertical integration strategy, executed through the Optum brand, allowed them to own the physician clinics, the pharmacy benefit manager, and the insurer, all wrapped into one. Sounds efficient, right? But that consolidation of power now looks more like a red flag. Why? Because in early 2024, Change Healthcare, a company acquired by UnitedHealth in 2022 for $13 billion, experienced one of the largest healthcare cyber attacks in U.S. history, affecting hundreds of hospitals and freezing billing operations for weeks. The repercussions weren't just digital, they were systemic. Lawsuits, congressional hearings, and calls for breaking up UnitedHealth quickly followed. Some even accused the company of becoming too big to regulate, with their corporate tentacles now touching nearly every layer of U.S. healthcare. And here's where it gets interesting. According to the latest insights, Optum Insight, UnitedHealth's data analytics and health tech arm, contributes over 10% of total EBITDA, showcasing how central their control over patient and provider data has become. And yet, despite that edge, they're under increasing scrutiny by the Federal Trade Commission, which launched a probe in 2023 into whether UnitedHealth is unfairly using its data monopoly to crush competitors. That's not a speculative claim. According to Bloomberg and Reuters this week, top healthcare advocacy groups have demanded structural separation between UnitedHealth and its data subsidiaries, citing the risk of anti-competitive behavior. So while Wall Street celebrates their diversified income streams, Washington is sharpening the regulatory axe. And now, we need to talk about exposure. You'd think with nearly 90 million plan members, UnitedHealth would be in a position of absolute strength. But the very scale of their empire may be their Achilles heel. Managing risk across that many lives, that many systems, and that many local laws has created cracks that competitors like Amazon Health and Walmart Health are now racing to exploit. And here's something most analysts aren't talking about. UnitedHealth is increasingly reliant on Medicare Advantage for growth, with nearly 45% of its health insurance revenues coming from these government-backed plans. But just this week, CMS released new performance metrics showing a drop in UnitedHealth's Medicare Advantage star ratings, which could slash reimbursements by hundreds of millions in 2025. And that's not all. Some state regulators are now calling for audits into whether UnitedHealth overcharges through its vertically integrated model. It's the same playbook big tech faced a decade ago. Grow fast, integrate tightly, dominate quietly, until public backlash kicks in. And in 2025, that backlash is here. Internally, too, warning signs are emerging. Although UnitedHealth has over 400,000 employees, insiders report growing tensions between the Optum units and the legacy health insurance division. Executive shuffles over the past year, including the appointment of Dirk McMahon as president of UnitedHealth Group, suggest a pivot toward stabilization amid mounting chaos. But critics say it may be too little too late. Let's not forget, in April, the Department of Justice reopened inquiries into whether UnitedHealth's merger with Change Healthcare violated antitrust laws, citing data misuse as a potential breach. So while the financials still look healthy on paper, the foundations may be less stable than investors think. There's a deep irony here. UnitedHealth positioned itself as the cure for America's fragmented healthcare system, but now many fear it's become the disease. A slow, creeping monopoly disguised as innovation. And that brings us to the final twist. In July 2025, whistleblower documents leaked to The Intercept allege that UnitedHealth used proprietary algorithms to deny care for elderly patients, not based on doctor decisions, but on predictive profit-loss models. The company denied wrongdoing, but the damage was done. So what's next? With lawsuits piling up, federal eyes watching closely, and the public beginning to ask whether one company should be allowed to run insurance, clinics, data, and drug benefits all at once, the once unstoppable behemoth might finally be facing its reckoning. Will UnitedHealth continue to grow, adjust, and dominate? Or will it be the next big corporate cautionary tale, brought down not by competitors, but by its own unchecked ambition? Only time will tell. But one thing is clear: the healthcare empire is under scrutiny, and the silence is breaking. This has been another signal from Copernicus Signals, where curiosity meets the truth behind power.